Listen, class. Okay, let's start with the mediastinum. 102 group. For 102 group, I think the mediastinum is not completed. Let's start with the mediastinum. Okay, then we will once again we will revise heart, then move to liver. Okay. What do you mean by mediastinum? It is the central compartment of the thoracic cavity or thoracic cage. It is the central compartment of the thoracic cage. Okay, and we can divide. You can see this is the central compartment of the thoracic cage, which is called the mediastinum. Okay, mediastinum. We have the borders of the mediastinum. Anteriorly we having the breast and ribs. Anteriorly we having the breast and ribs. Laterally we having the mediastinum pleura. Laterally we having the pleura. Inferiorly we having the diaphragm. And superiorly we having the upper aperture of thoracic cage. Okay, thoracic aperture. Okay, and posteriorly we having the vertebra and the ribs. These are the borders of the mediastinum. You can see anteriorly we having the breastbone or breast or the ribs or sternum or the ribs. Inferiorly we having the diaphragm. Superiorly we having the thoracic aperture. Posteriorly we having the vertebral column and the ribs. This and the space inside this is called the mediastinum, and also having the structures, many organs, vessels, heart. There are many structures present in the mediastinum. Okay, we can divide the mediastinum into superior mediastinum and inferior mediastinum. Okay, superior, you can see superior mediastinum and inferior mediastinum. We can divide the superior and inferior mediastinum at the level of the sternal angle. Sternal angle, you know the sternal angle. Yes. The sternal angle is also called angle of Lewis, right? Angle of Lewis. And the angle, where is located? Location of the sternal angle. Sternal angle. Location of the sternal angle, where it is located. We have the sternum, right? Sternum having three parts: manubrium, body, and the xiphoid process. Between manubrium and body, we having the sternal angle. Okay, at the level of the sternal angle, we can divide the mediastinum into superior and inferior mediastinum. It's anteriorly. Posteriorly, at the lower border of the T4, thoracic vertebra, at the lower border of the T4. Okay, again the inferior mediastinum can be divided into anterior, middle, and posterior. Anterior, middle, and posterior mediastinum. Okay. What do you mean by mediastinum? It is the central compartment of the thoracic cavity. Okay, it has the borders. Okay, inferiorly we having diaphragm. Anteriorly we having the breast and ribs. Laterally we having the mediastinum pleura. Okay, and posteriorly we having the vertebra and thoracic. Superiorly we having the aperture, thoracic aperture. Posteriorly we having the vertebra and the ribs. Okay, and we can divide the mediastinum into superior mediastinum and inferior mediastinum at the level of the sternal angle. Okay, and posteriorly at the level of the inferior border of the T4. Okay, and the inferior mediastinum can again divide into anterior, middle, and posterior mediastinum. Anterior, middle, and posterior mediastinum. And the heart is located in which mediastinum? Middle mediastinum. Just open the PPT which I shared. The mediastinum, the PPT of mediastinum, just open it. Okay, just see the examples. The anterior mediastinum contains pericardium, trachea, main bronchus, thymus, diaphragmatic nerves, and a parasternum lymph nodes, right? And the posterior mediastinum contains esophagus. Okay, and you go down and you can having the middle mediastinum, anterior mediastinum, again it's written there, anterior mediastinum, middle mediastinum, and posterior mediastinum. Okay, you have to by heart the structures present in each mediastinum, and the heart is located in the middle mediastinum. Okay, this you have to remember. This is about the mediastinum. Okay, you have to study the structures present in the superior mediastinum and inferior mediastinum. In inferior mediastinum we have the anterior, middle and posterior mediastinum. Okay, this you have to remember. And last class we studied about heart also, right? Heart is a muscular organ. Heart is a muscular organ. Okay. Yesterday we discussed about the heart. Last class we discussed about the heart. Okay? Heart is a muscular organ which is located in the middle mediastinum. Okay. For what's the function of the heart? Okay, it is the main organ which supply blood all over the body, right? All over the body. Heart having three surfaces. The heart having three surfaces. Which are they? Anterior, lateral, right and left lateral, and inferior surface. Okay, anterior surface, which is the anterior. This is the anterior surface, which is called a sternocostal surface, and the inferior surface, which is called a diaphragmatic surface, and the lateral surface, right and left lateral surface, is called a pulmonary surface, right? And also we having the apex and the base of the heart. Apex and the base of the heart. The apex is located anteriorly, inferiorly, left. Anteriorly, inferiorly, and left. And the base of the heart. Base of the heart is located posteriorly, superiorly, and right. Okay, this is the location of the heart. Okay, and heart, you know, heart we having the four chambers of the heart, right? Four chambers of the heart: right atrium, right ventricle, left atrium, and left ventricle. Okay, and the septum between right atrium and left atrium is called interatrial septum, and the septum between left ventricle and right ventricle is called interventricular septum, and the septum between atrium and ventricle called atrioventricular septum, right? And also we have the wall between right atrium and right ventricle is called a tricuspid wall. Okay, we already drawn that picture of the cuspid, right? Okay, and the wall between left atrium and the left ventricle is called a bicuspid wall. Bicuspid wall is also called a mitral valve, right? And what is the specialty of the wall of the left ventricle? The wall is thicker than right ventricle. Why it's like? It's the function, because we have to pump more blood to create a pressure. That's why the left ventricular wall is more thicker. Okay. And we have the circulation. We also discussed about circulation. We have the greater circulation and lesser circulation. Greater circulation is also called a systemic circulation, and the lesser circulation is called a pulmonary circulation, right? We already drawn the diagram of the circulation once again. Okay, this is the representation of the heart: right atrium, right ventricle, left atrium, left ventricle. Okay, the greater circulation starts from the left ventricle to the body parts through aorta, right? Aorta. From the body parts, the deoxygenated blood reaches to right atrium through inferior and superior vena cava. And we already discussed the wall between right atrium and right ventricle. We having the tricuspid valve, left atrium and left ventricle bicuspid valve, right? Right. And also we having the semilunar valves here. Here we having the aortic semilunar valve. This circulation starting from the left ventricle to the body, from the body to the right atrium. This is called a greater circulation or systemic circulation. Okay. Then from the right ventricle, the deoxygenated blood reaches to lungs. Through which vessel? Pulmonary artery. Then from the lung, the oxygenated blood reaches to left atrium through pulmonary vein. What is the concept of vein and artery? The artery which carry blood away from the body, and the vein which carry blood to the heart. Okay, you have to remember this circulation is the greater circulation, and this circulation is the lesser circulation. And here we having pulmonary semilunar valve. Here we having the pulmonary semilunar valve. Pulmonary semilunar. And we also already discussed about the internal structure of the heart, right? In the atrium, we have the 2 atrium and 2 ventricle. And about the septum, we already discussed. And what the muscles of the atrium is called? Pectinate muscles. And papillary muscles present in the ventricle. And other structures present in the ventricle. We are having the chordate tendina, right? Here we are having the chordate tendina, papillary muscles, okay, papillary muscles. And you know the what? This is the tuberculum cornea. Tuberculum cornea also is present, and we are having the tricuspid valve between right atrium and right ventricle. Okay, right atrium and right ventricle, and left atrium and left ventricle. We are having the bicuspid valve, and you can see the semilunar valve. This is the which semilunar valve? This is the pulmonary semilunar valve, and this one is the aortic semilunar valve. Aortic semilunar valve. Then about the coronary circulation, right? Coronary circulation. For the functioning of the heart, we need the blood supply to the heart also. That's provided by the coronary circulation. From the bulb of the aorta, we are having emerging 2 arteries, right and left coronary artery. There are 2 branches of left coronary artery, anterior interventricular artery and circumflex artery. And from the right coronary artery, we also have 2 branches, posterior interventricular artery and marginal artery, right? Marginal artery. And also we have 3 coronary veins, the middle cardiac vein, greater cardiac vein and a smaller vein. The smaller veins is called Tebessee vein. Tebessee vein. And also discussed about the auscultation of the heart. Auscultation. Okay, we are the 5 points of auscultation. First one, the aortic semilunar valve sound can be heard at the second intercostal space at the right sternal border, and the pulmonary semilunar valve sound can be heard at second intercostal space on the left sternal border, right? Sternal border. And mitral valve sound can be heard at the apex of the heart at the 5th intercostal space, and the tricuspid valve sound can be heard at the xiphoid process towards the left border, sternal border. And one abnormal sound only in the case of aortic insufficiency we can hear the murmur at the 3rd intercostal space towards the left sternal angle. That is called a Erb's point. Okay, these are the auscultation point. And about the conduction of the heart, SA node, AV node, AV bundle. Okay, you know about this, you already studied in physiology, and we will discuss more in later classes, upcoming classes. This about the heart. Then just move to the liver. Okay, liver. What happened? About the layers of the heart. Okay, heart is covered by a serous membrane. It's called a pericardium, right? We have 2 types of pericardium: fibrous pericardium and serous pericardium. The serous pericardium can be divided into 2: parietal pericardium and visceral pericardium. This visceral pericardium is also called epicardium. Then we have the myocardium. Then we have the endocardium. These are the layers of the heart. You have to remember, okay? And the pattern of muscle present in the myocardium pattern, it's a pattern of 8, right? The muscles present in the atrium is like this, and the muscles present in the ventricle is like this. This is the pattern of arrangement of muscles in the myocardium. Then just move to the liver. Okay, then first I will show you a video.
The lobes and margins and the grooves we have on the surface of the liver. And then we're going to talk about the gluta hepatis, along with how the liver is located. Basically going through the coverings and the ligaments around the liver. So the liver, or the hepatis,